Hi, let's talk about time management in the NICU. My name's Lisa. I'm an experienced NICU nurse and a NICU nurse educator. And I just wanted to give you some of my greatest tips and tricks and just say what has helped me over the years. I want to start by saying when I was brand new, I would like to say it only took me 6 months, but let's be honest, probably a year or two. I couldn't do this. Like I had to be very precise with my time management. So if you are new, I really am going to start by just saying, give yourself some grace. So the number one most important thing I think we need to do is to let our parents know about care times. I have a love-hate relationship with the idea of care times, as you may know if you followed me for a minute. But what we need to tell parents is, cares feeds are at 8, 11, 2, 5. We usually start about a half hour early. If you know you can only be here right at 8, why don't we come up with a plan of what I can do to help the baby be best prepared and what I can say for you to do when you get here? Is it most important to you if the baby is bottle feeding that you are doing the bottle? Or is it most important to you that you're doing the diaper and the repositioning? If the baby's a gavage feeder, do I have some wiggle room where I can sneak in and just do my assessment with the stethoscope and then you can come for the temperature and the diaper? Make a plan with your family, and then that plan should be communicated during nurse-to-nurse shift report so that the same plan is being carried out. If you have 2 8 o'clocks, which one are you doing on the early side? Make sure you're communicating that to the next nurse and to the family. So family communication is number one most important because they should be the primary caregivers and we should be the helpers, and I will die on that hill. Number 2, yes, you need to start early. Sometimes starting early means you're getting your milk warm, you're doing your med calcs, you're gathering your meds, checking your incompatibilities, whatever it is. And that might be what you do early because you know you're saving the rest of it for when the family gets there. If the family's there, you should be watching for those babies' quick silent cues that they are ready for their cares and then getting in, temperature, diaper, etc. Family's there doing it. And my third greatest tip is have a kind of order and plan that you do every time you're with the baby. So for me, that was I go into the room, I warm up my milk, and I put on my blood pressure cuff. Then I walk away and get the supplies I'm going to need, a diaper, the wipes, the medication, etc. Then I come up and I cycle the blood pressure because the baby has requieted during that period of time. Cycle the blood pressure, then we start. Hopefully the family is there, so now we're going in together. They do the temperature, I'm doing touch hold, or the other parent's doing touch hold, whatever it might be. Then it's a head to toe. I always change the diaper last. For me, that's important because my hands sweat and I don't want to change my gloves 100 times because then I'm not going to be able to get the gloves on. That's the real reason. And as you go head to toe, it's also systematic, and usually that's also how your EHR is, whether you use Epic or Cerner or whatever you're using, it's probably in a head to toe fashion. So those are my 3 biggest tips. I will probably come on here and do a few more tips, but if you can do those, start by giving yourself grace, but then communicate with the family, start early, and have your own plan of how you go in the room every single time. It's going to help you.